And among other things, China is now irking foreign visitors with its anal swab tests for COVID-19. The checks, as offensive and indignified as they sound, are required at Beijing, Shanghai and the port city of Qingdao for some international arrivals. Now, the checks, which are in addition to nasal or throat swab tests, have stoked debate over their necessity, along with apparent complaints of inconvenience and even psychological trauma. Early this week, Tokyo complained about the tests on some Japanese travelers to China, saying they had caused great psychological pain. Last month, reports cited a State Department official as saying US diplomats had been subjected to these tests. A Chinese Foreign Ministry spokesman said that, to his knowledge, such tests had not been required of US diplomats in China. In a statement, the ministry said the virus prevention and control measures China was taking were based on science. Some Chinese doctors even justified the tests by saying that such tests can ensure infections are spotted, since the infection, coronavirus traces that is, can be detectable in the anus for longer than in the respiratory tract. But a virology professor at the University of Hong Kong, Jing Dongyang, says that a positive result does not necessarily mean that the person tested can spread the virus. Now, inactive traces, unable to replicate or infect others, can also show a positive. That's what he meant. Now, anal swab tests are not exclusive to foreign visitors. During China's last major round of infections in January, some cities performed them on unspecified segments of the local population as well. The World Health Organization has primarily recommended testing respiratory tract specimens to diagnose respiratory diseases because they give the best samples in this case. WION is now available in your country. Download the app now. Get all the news on the move.